Hey, everybody. It's noon. We're going to give people another couple of minutes to trickle in and then get started and can get the YouTube stream going as well if that's already going. Hi, YouTubers. And thanks to everybody who's joined us so far. Just going to give people 1 or 2 more minutes to get out of class or whatever and come and join us on this gray Friday. But it's been a good news week, as I will share. Anybody else having a hard time believing it's already mid-September? Doesn't it just seem like it was New Year's Day like that long ago? Sierra is screaming by. All right, 12:01. I'm going to give people till 12:02 and then I'm going to get started. So text your friends, snap your friends and tell them to come. Now, to those of you who are here, thanks for being here. Okay, it is just afternoon. Welcome everyone. It's great to have so many folks here at our student town hall. And I know many of you might be watching this as a recording later. And if so, if you're doing that right now, thanks for tuning in just to get the latest. And it's great to have everyone. So today we're gonna do a few things. We're gonna have a few speakers and presenters, and the most important thing we'll do is answer your questions. But really, we want to share information with you and give you an update and just an opportunity to engage. So on the next slide, I will start this town hall as I start all town halls by talking about those things that are really driving us right now, what we call our North Star. This is our guiding light. And which is, as that top bullet says, first and foremost about keeping our community safe and healthy. Obviously, we're in a dynamic time in the history of this pandemic, which is turning into a long history, unfortunately. But on one hand, there are many good things happening, vaccines and treatments and such. On the other hand, we still have cases happening. And so we've got to balance all of the risks and rewards there, and keeping our community safe and healthy is front and center in my work, in the work of CERT, in the work of everyone on this campus right now. And we want to do that while we're serving all of you, our students. And in times that, last year was unprecedented. This year feels a lot more normal on campus, but still not as much normal as all of us would have hoped. And so we are managing and trying to make adjustments and make sure that all of you can be having experiences both in the classroom and outside the classroom that are helping you advance your own goals. So serving you is really why we're here. And so my job in this moment, and the job of so many of us, is to support our faculty and staff as they're delivering on our educational and research missions with all of you, keeping our WPI family together here on this campus so that we can do all of that as effectively as we can. I always talk here about making sure that we're treating each other with the care and respect that we all deserve, because this is a stressful time. It has been. These last couple of weeks have been stressful, and some people can tend to get, cranky, short, whatever, when that happens. And just remembering that intentions are, even when we disagree, intentions are almost always good. And so just treating one another with the care and respect that we need. And you all are great examples of that. You do that very well. And then finally, it's not just about WPI, but what we do here impacts the broader community of Worcester, the state of Massachusetts, the region, and the world. And so making sure that as we are taking care of ourselves, that we're also taking care of our broader community. So that's really, those are the things that are guiding our decisions each and every day. Let's talk a little bit more on the next slide about what we're going to do today. So here are our goals for this town hall today. One is just to share a bunch of information. For those of you who like numbers and data, guess what? You're about to see a bunch of it. Yay! We're all data geeks. Come on, let's admit it. We all love to see the numbers. So sharing the latest information and how that's changed over the last couple of weeks. And I'll tell you right now, it's changed for the better by quite a lot. So thank you to everyone who's tuned in and to everyone who's watching and to all of your friends as well for all they've done to help us bring this increase in cases back down and back under control, because I believe that is where we are now, and that's exciting. We're going to break down the data and give you insights into exactly where the cases are coming from. As we think about mitigation strategies, you have to understand what you're trying to mitigate in order to make that work. So give you some more insights there, discuss kind of where we are and where we're headed. So where we are today, what's going to evolve evolve back to where we were starting next week, and looking to the future a bit. And then again, most importantly, answer your questions. So that's what we're going to do today. And then I'll just, on the next two slides, just give you a quick background, and then I'm going to hand it off to others who are going to dive in a little deeper. But next slide talks about kind of the foundation for our operations this year, which has to do with vaccinations, right? Because vaccines are effective at protecting against serious illness, against hospitalization, and against dying of COVID. And so because of that, we know the Delta variant is giving us breakthrough cases, and you'll see in the data that that's the case, but no one's getting seriously ill, and we're very well protected as a community against serious outcomes. But again, we are seeing some spread, so we have to protect against that. And the higher number of cases we have statistically, the more concerning it gets. And so we have to still manage to try and keep our numbers as low as we can. But here in our campus community, the vaccination numbers are high and continuing to increase. Over 96% of students are vaccinated, over 94% of employees are vaccinated. Both those numbers are creeping up towards the next highest integer. So 95 and 97, they'll probably be there quite shortly, as our international students, some of whom didn't have access to vaccines at home, have come to campus and been vaccinated here. So the student numbers ticking up. And we have instituted an employee mandate over the last month or so. And so the employee numbers are ticking up as well. And again, we all sort of hope that meant, okay, COVID is done for us. Well, it doesn't exactly mean that, but it does mean that we're well protected, and it builds this very strong foundation. As you just remember, last year, we talked about layers of safety, masks and tests and all these things. Vaccination is a really important layer of safety, and we've got it. And I just was on with the medical director for the city of Worcester this morning, and he's like, we're just all blown away by how well everyone's done with the vaccines on their campuses. And he thanked us for that. So I want to thank you for that. So that's the good news. We're starting from a real place of strength. If you go on to the next one, this just gives you the overarching data about COVID cases in our community. So this is the last month from left to right. From left side is a month ago. The right-hand side, this is 9/15, which is 2 days ago. So today, when the dashboard updates, you'll get yesterday's data, which are also low. And I'll tell you, today so far is also low. But the thing that was scary was those peaks back a week ago and 2 weeks ago, that day of 30 positives, and then a bunch of days of 15 to 20 positives. Those are numbers that overwhelm our healthcare system here on campus, right? And we just can't accommodate that for too many days in a row. And it was not going in a good direction. And so when we sent out the message 2 weeks ago today saying, hey, hang on, this is not good, and asked everybody to really re-examine their behavior, especially off campus. And then we changed our testing approach, which we'll again talk about here today. Since then, so the first 2 days after Labor Day are the 20 and the 18, the last two high days, which were the first days we tested absolutely everybody in the community with that individual PCR test. So we were expecting to see a lot of cases those 2 days. We kind of got all those folks who had contracted COVID and got them into safe isolation. And since then, we've really seen the numbers come down. And you can see, so for over the last 5 days, we're averaging just a couple of positives a day, which is really, really a huge progress by this community. So my main message to you is thank you for all that you've done to help us manage this. By the way, I should have mentioned this at the top. So we'll take questions at the end. We want to answer your questions. If you have questions, you can type them into the Q&A function that you'll see on Zoom. And either somebody here will type an answer or we'll save it for the end and we'll discuss it. So please do share your questions with us, and hopefully we'll answer a lot of them as we go through here as well. So that was it for me, but we're going to show you more data and more about what we're doing. I'm going to hand it off to our Vice President for Student Affairs, Philip Clay.
Thank you so much, Laura. Kate, if I could have the next slide. So as promised, we're going to have lots of data for you this morning. And so working from the slide that President Leshin just showed you, what we wanted to do is really look at, over the past 2 weeks, do a 2-week comparison in terms of the positive cases, just really to illustrate how the changes in the behavior that primarily students have made, and we'll see that most of the positive cases that we've seen in the last, really since start of school, have been student related. But to see the positive impact of the changes of behavior that you have made and the impact on our numbers. So you can see from 2 weeks ago, last week, 97 cases versus 31 in the last 7 days. And this really is a snapshot as of Tuesday of this week. As this snapshot data really coincides with our CERT meetings. You can see that we've reduced the number of student cases by 2/3, 96 to 31 in that 2-week period. And we'll talk a little bit more about breakthrough cases and unvaccinated. But one of the interesting things for us in CERT, as we've been looking at the data, and particularly within the health team, is that a lot of the information we've been having in the news, seeing in the news, has really been about the outbreak of the Delta variant within unvaccinated communities. And we really didn't have a sense of how this is going to impact us as a primarily vaccinated community, as the president just talked about. And so you can see here that for the breakthrough cases, the vast majority, overwhelming majority of our cases are with students, community members who are already vaccinated as opposed to unvaccinated. And as the president already talked about, most of those students, almost all the students and those who've tested positive have had very little illness, so have not gotten particularly sick. But it's been very interesting for us because frankly, this was not what we expected, but there wasn't a lot of data out there about the impact of the Delta variant on a vaccinated community. And because we have a robust testing system, that's how we're able to identify the number of students and those that are impacted by it. In terms of isolation and quarantine, again, you can see a dramatic shift in these numbers. And if you look at the bottom of the chart in terms of close contacts, you get a really dramatic shift in terms of the number of close contacts. The reason we wanted to highlight both students in isolation as well as close contacts is that, as the president just talked about, these are the things that really strain our system. And so the more close contacts we have, the more that the health team has to follow up with, and just more of the resources are spent in terms of following up. We have a finite amount of isolation and quarantine space on campus in our townhouses. And so as those spaces fill up, those are the things that will start to break our system and cause us to take some kind of action in response to that. And so again, thanks to the great work that everyone's done over the last week to really change some of those behaviors, we're really seeing some positive changes in these numbers. So Kate, if we can go to the next slide. So now I'm just going to go through very quickly a series of pie charts, which really break down this data even further. So you can see over the 14 days between the 1st and the 15th of September, we can see that of the 131 cases that we have had, 2 have been staff who have tested positive, 0 faculty members, and 129 students. So obviously the vast majority of those that have tested positive in this 14-day period have been students. Next slide, Kate. I just talked about this actually, and the difference between the impact of positive cases on those that have been vaccinated versus unvaccinated. So you can see again, the vast majority of the positive cases are what are known as breakthrough cases of fully vaccinated students. And it says that these pie charts that I'm showing right now are primarily going to be student data as opposed to the faculty and staff data. So next chart, please, Kate. Wanted to show you a little bit about the breakdown by class year. And so you can see over the same 14-day period, you can see that in terms of the cases, only 3 graduate students have tested positive, 2 first-year students, and then it's about split evenly between juniors and seniors, and then about 50% of the cases, or 50 of the cases, excuse me, actually are for our sophomore class. And so you can see that this is not a, right now in terms of our positive cases, not really something that is impacting students on campus, where primarily most of our first year students live in, and it's the really almost evenly distributed between sophomores, juniors, and seniors. Next slide, please, Kate. Then to break that down further, this is the breakdown between where students are living. And so you can see only 10 of those cases in the last 14 days are students who live on campus. And we just saw that 2 of those are first year students, and the rest are upper class students living on campus. But the 90% of the cases are by students who are living off campus in some kind of living arrangement. So that could be apartments off campus, it could be commuter students living at home, it could be students living in fraternity and sorority houses. And so again, the reason that we talk about this is to show, and we'll be getting to this in the next slide, that where we have seen the outbreak thus far in terms of the contact tracing really is in off campus, students who are living off campus and not those who are living on campus. Kate, can we see the next slide, please? So what does all that tell us? Because we have very little spread on campus, and we know that it's very little spread from the students living on campus. The places that our on-campus students frequent most often, dining halls, the residence halls, we're seeing very little spread in those locations. In fact, almost no spread. That includes libraries, offices. And so even students that are living off campus and on campus, we're really seeing very little on-campus spread. None in the classrooms or in any of these settings. And so that's fortunate because otherwise our numbers would be much higher. But what it does tell us, and a lot of this information comes from the health team, is they've talked to students about students who are positive and looking at their close contacts as they follow up with them. Here's some of the things that we've learned regarding where some of the spread has been taking place. And that is primarily off campus in unmasked situations. And so what we know from some of that follow-up is, a couple large off-campus gatherings, just as students who are returning, generated really many connected cases. There were several small gatherings of, say, 6 to 8 people, and that could include all sorts of variety, just having friends over for dinner. It could be a birthday party. It could be just coming over to watch movies. But as students are arriving, doing what we would naturally expect, reconnecting with your friends and peers. But in those early days, in those first few days of the semester, right around the beginning of September, that's really where the spread started to happen from some of these, larger gatherings and some of the smaller gatherings in the off-campus settings. That could also include restaurants or bars off campus. That's where the spread started to happen. And then we saw the second wave, if you recall the chart that President Leshin talked about, sort of that second wave really came from the close context of that first wave. In many cases, that was roommates and apartment mates of those first cases that then turned positive. When the health team talked to the individual people who were close contacts, nearly all of them could identify at least one exposure. They had already been in contact with one of their friends who said, yes, I've tested positive. So they were already expecting to be a close contact. But in some cases, traveling within this social circle, there may have been multiple exposures. So they knew several students in their circle of friends who had tested positive. And then finally, the thing, and President Leshin already talked about this, is that the fortunate thing, because of our highly vaccinated population, is that most of the cases students have not gotten seriously ill. But unlike last year, actually, we're seeing more symptomatic cases, mild symptoms like runny nose, cough, and fatigue. And that's something that's a little bit different than what we saw last year. Again, that's something that we're sort of learning this year, that even in the vaccinated population with the Delta variant, although students are vaccinated, we are seeing more students that are presenting symptomatically, as opposed to having COVID and having no idea that they have COVID because they are, and then are surprised when they test positive. We still have some of those students, but by and large, many of the cases this year, students are symptomatic by the time they test positive. So that's a little bit drilled down into the data. And with that, I'm going to turn it over to Emily Perlow, our Associate Dean of Students, who's going to talk a little bit more about the implications of that data. Emily?
Thanks, Philip. Before we do that, let's flip to the next slide. We want to have a couple of interaction points with you as we're sharing some information. And we'd like to ask you to use the Q&A section here on Zoom to tell us a little bit about what you're thinking. So you've had a chance to see the data here. What are your reactions? Is it trending better than you expected, worse than you expected, about what you expected? Let us know by typing into the Q&A section. And as folks are doing that, Kate, why don't you pop to the next slide, and we'll talk a little bit about what you can expect as we move forward, starting on Monday. So we're excited to announce that we'll be returning to in-person course delivery. So for folks who may have had a course shift a portion of it perhaps to virtual, we'll be asking faculty to return back to that in-person delivery. That is, except obviously if you're taking an online course. We've also continued to advise faculty to maintain flexibility for students who may need to miss class. And that could be because, as you see in the graphic here on the slide, maybe you're experiencing some COVID symptoms. Maybe you are a close contact. And so that flexibility we know is incredibly important. We're going to talk a little bit about some things that we really need from students in the next couple of slides. And one of those things that we really need from students right now is please, please, please do not go to class if you feel unwell. This culture of sort of pushing through at all costs, which is very much part of the WPI culture, and I fall prey to it too. You know, there are days, pre-COVID where maybe I, wasn't feeling so great, and I'd come to work anyway because I had things I had to do. And we really want to encourage folks to stay home, fill out your symptom tracker, try to access those things remotely, and please, please, please do not go to class if you're feeling unwell. And sometimes it can be hard to tell, especially in the fall. I have pretty bad seasonal allergies. And so sometimes I'm like, is this allergies or is it something else? If there's any question, just stay home that day, please. One of the things we're going to do is all suitable classes, not every class is well suited for this, but all suitable classes will be offering lecture capture so that you can make sure you don't miss out on anything. Next slide, Kate. Let's talk a little bit about health. I'm going to say it again. Only go to class when you're feeling well. If you feel unwell for any reason, please, please, please fill out that symptom tracker and do not go to class. You can contact through the symptom tracker, health services will reach out to you, or you can also call health services. If you're identified as a close contact, please follow the guidance that the folks who will call you and give you some instructions on what you ought to do. Make sure to please follow that guidance closely. And then additionally, starting this week, folks are starting to get messages if they've missed a test. So for example, if you test twice a week and you don't test basically every 3 to 4 days, you'll get a reminder. You can also see your status in terms of last test and kind of where you are on the hub if you log in to my TechFlex. And so you can go and see how you're performing, or if you get that message, follow those compliance reminders and go get tested if you miss your test. Next slide. So with regard to testing, we are going to be continuing undergraduate students testing twice per week. So please continue to plan for that twice a week test if you're an undergraduate student. If you're a graduate student, and faculty and staff will be testing 1 time per week. So I would recommend, and folks who joined the town hall over the summer also heard this from me, if you're like me and you're going to get busy and you're going to get distracted by all the things that you have to do, make an appointment, because it'll send you a text reminder and an email reminder, and that will just help you make sure that you keep things on your radar and you don't miss that test. So you can actually make them for the rest of the term if you'd like. You can just hop right on. If you type in, even if you Google, if you type in COVID testing plus WPI, it'll bring you right to the site. As a reminder, a negative result, you'll get an email from WPI COVID testing. If you have a positive result, you'll get a call from health services. And there's a couple of other rare results that you may get. And in both cases, you'll get an email or a call explaining what your next steps would be. Next slide. All right, we also want to hear your thoughts on this. One of the things we think a lot about is, how do we best reach students? How do we help folks get the news and the information that they need in the way that they most want to consume it? And so we'd love for you to give us some input into where you're getting your WPI COVID related intel. Do you prefer email? Are you finding out on the Discord server, or getting it from Reddit or social media, or is it word of mouth or your parents? Let us know, where do you find out the information you need to know about WPI COVID related protocols, procedures, and expectations. So type that in the Q&A and share with us how you want to receive that information. All right, and as folks are doing that, let's go ahead and bump to the next piece of content. And thank you for folks who've been typing in and giving us input. Want to talk a little bit about events. We have 230 clubs and organizations on our campus, and I know those event leaders have had a chance to meet with student activities last week to get some guidance. We're going to maintain some of the same guidance moving forward. So in general, please try to have your events or activities or meetings outdoors wherever possible. The weather is still beautiful. It looks like we're hopefully going to have a beautiful fall, a little gray today, but for the most part, a beautiful fall. And so do your best to be outdoors with that wherever possible. If you are outdoors and it's a large gathering and you can't maintain social distancing, then we would ask that you also ask folks to wear masks. If you're indoors, for example, if you can have a meeting that is socially distanced indoors, we would certainly support that. Make sure that folks are wearing masks and maintaining that distancing. If you can't offer a meeting space where people can social distance, move outdoors or consider going virtual. And I really want to emphasize something right now that I think is really important. I've talked to a number of student leaders this week, and a lot of folks 2 weeks ago when the news came out that we wanted to make some modifications to events, just immediately flipped to going remote. And I think the reality is nearly all of us don't want to be remote if we can safely gather together. And for that reason, I want to encourage folks to not solve this year's challenges with last year's solutions. It was easy to go remote. Sometimes it's more efficient to go remote. It takes a little more effort to reserve a new room. But we know we all want to be together. Most of us don't want to be meeting on Zoom. And so everything you can do as a student leader who might book space, to do your best to try to pivot and really think creatively. The student activities staff and the event staff would be happy to brainstorm with you to figure out how do we help you achieve the goals of your meeting within the guidelines. So I don't want you to feel like you immediately need to flip to Zoom. That's not necessarily the default. And so please, please, please contact student activities or events if you're not sure how to pivot your event in a way that allows you to still do it in person. With the graphic you see here on the slide, these are just some of the questions that will kind of determine how your event moves forward. So can you offer it indoors or outdoors? Is there food? Will people be eating and drinking? In that case, we really want to make sure folks are socially distanced. Who's going to attend? So if it's just students, awesome. If you happen to be having an event with students and employees, or students and external visitors, we do want you to consult with SAO and or the events office, and they'll help provide some additional steps that you may take to help make sure that if we have any external guests or we have any employees attending, that we're following the guidelines. For any event, we really want you to take attendance and save it for later for contact tracing. If it's a student only or a student and employee only event, you can get a card swiper from the Campus Center information desk. And it's just as simple as plugging that in, opening up an Excel spreadsheet, and you can swipe and it'll catch folks' IDs. And so it's a pretty easy way and a very quick right at the start of your meeting to take attendance. Clean high-touch surfaces before and after, and of course, observe distancing and mask wearing if you're indoors, and a mask wearing if it's a large gathering outdoors. Next slide, Kate. All right. Folks may remember BuzzFeed did this a lot, like a eat this, not that. Eat the bagel, not the donut. They're the same calories kind of messaging. And so I've been thinking a lot about that. And so I tried to put a couple of things here on the slide that might help us sort of re-envision how we can do things. So instead of an indoor concert with 1,000 people, maybe think about going to an outdoor concert with 300 people spaced out. If you're looking to have a team or a club dinner inside of a small apartment, which was what we might have done in 2019, instead, what if the team or the club goes to the movie on the quad or to an outdoor sporting event together? It's just as much fun. You'll get a chance to get to know each other, and you can still achieve the same goals in a slightly safer way. Instead of reverting to Zoom for your club meeting, once again, try to reserve a bigger room that allows for distancing. You can still have that meeting in person. We just need to take a couple of additional steps to make sure it's as safe as possible. Next slide. Also looking forward, a couple of other things we want to encourage. So when you're dining, and I've been seeing it outside the campus center, folks are sitting at the tables outside. We really want you to go and consider taking your food outside to eat. You can do grab and go at any of our campus dining locations. So for example, if you dine at Morgan, feel free to just say, hey, I want to take this to go, and they'll help pack it up for you. You can also bring your green to go container if you have a carabiner, which you got when you moved in. That's another way to get that recyclable green to go container to take food to go as well. We are, as you've probably seen across campus, bringing back more seating and more tents outdoors so that folks can dine or gather outside. We are also, this is a change. So over the last 2 weeks, indoor contact activities. So for example, basketball in the rec center, we weren't offering those because of the close contact. Those are now okay as long as folks are wearing masks. So that is a change for anyone taking a PE course, or if you're doing club sports or just general pickup basketball or other things, you can do that with masking. We do want to encourage folks to please make sure you're wearing your mask properly indoors. That means over your nose and mouth. When you cannot socially distance, please wear it outside as well. Next slide. Wanted to take a few minutes, as Vice President Clay shared, we saw a fair amount of transmission out or off campus, and often what we were seeing were unmasked gatherings. And so we wanted to offer a little advice and maybe do some brainstorming on what are some things that folks could do instead, because the goal is not to make people just sit in their rooms and not do anything. Our goal here is to help folks know how to gather safely and in ways that reduce the likelihood of COVID spread. So we would strongly encourage folks who are avoiding off-campus parties and large gatherings, that folks are taking steps to try to protect the bubble and limit their off-campus exposure, and that wherever possible, you're gathering outdoors. You've heard me say that a couple of times. So a couple of ideas. So if you want to gather with your friends, instead of doing that inside in an apartment somewhere with no distancing and no masks, consider having a backyard gathering with lawn games, and make sure that the size of your gathering is such that it allows for people to socially distance. Just watch the volume and make sure you're not disturbing your neighbors. Instead of inviting a ton of friends to your apartment or house, consider keeping it small. Keep it in your usual friend group, the folks you generally hang out with. If you're gathering with your club or your sports team, as an example, or any other kind of group on campus for a spaghetti dinner, why not instead host the dinner, but instead grill outside and eat outside, and do your best not to use shared utensils. So those are just a couple of ideas. If folks are looking for suggestions or ideas, once again, the Student Activities Office is here to help you, as well as the Dean of Students Office. We're happy to help you figure out how to do it safely. Generally, there are ways to do that. Next slide. All right, so here's our last question for you, and we'd love to have you toss your thoughts into the Q&A box. We want to know what you wish you had more information about. What do you feel like you still have questions on, or you're not certain about, and you think maybe other students might have questions about it? Type it into the Q&A box so we know, and we can make sure that we're giving you that information that you need. All right, next slide, Kate. Here's one other way we'd love to hear your input. If you want to scan that QR code, it will take you to a form. We're forming a group of students who will serve in an advisory capacity for our CERT team and for the Dean of Students. And we want this group, it might be a group where we might email periodically to say, hey, we'd like some input on the social media campaign, or hey, you know, what are some things you're hearing from your peers that they're worried about? Let us know. We might also say, hey, we want to talk about, we want to talk about quarantine policies and get your input. Meet us at Starbucks, and a couple of us will be there to hear your thoughts and ideas. And so if that's something that sounds interesting to you, we'd love to have you scan that QR code, fill out that form. It's just a couple of questions, and we're going to start to build that list of folks who are interested in giving us input. So please feel free to do that, and feel free to share that with your friends as well. And we'll leave that slide up just a bit, so folks have a chance to snap the QR code. And our last slide, which we're going to pop to in just a minute, really just summarizes some of the things that we've talked about. Once we go over that slide, then we're going to shift to some questions. So if you have questions, definitely be typing those into the Q&A section here on Zoom, and we'll switch to field those in just one moment. Kate, can you flip to that next slide? Thank you. All right. So quick summary, we've got this. That's the number one thing I want to say. We're going to be able to keep this under control as long as we're communicating, collaborating, testing, and making decisions based on the science. And so as we do that, we're asking everyone in our community to get tested, follow those safety protocols, really work hard to minimize those close contacts to the degree possible, make smart decisions around gathering, which means avoiding those unmasked gatherings. And then most importantly, taking time to support one another. We know, I think a lot of us are feeling some COVID fatigue, right? Where we thought maybe this year might feel a little different, and Delta had a vote in that. And unfortunately, it still feels like we're responding to COVID more than I think many of us were prepared to do. And so if you need support, talk to someone, lean on a teammate or a friend, or contact the SDCC. You know, this is a community that really takes care of each other. And I think we have to continue to do that in this time. The last thing I want to say before we switch to hearing your questions and fielding those for you is that, you know, I talk to a lot of parents and a lot of students, and everyone that I'm hearing from maybe has some different thoughts about how we function on campus, what the rules and regulations should be. But every single person I talk to has the same shared goal. And I think that's true for CERT. I think that's true for faculty and staff. I think that's true for students. At the end of the day, we have a shared goal, which is to offer as safe and as positive a school year as possible. And so I think if we all remember that we do share that goal, we all want the same thing, I think that's going to help make sure that happens. So with that said, let's flip to fielding your questions. I see a few in the chat, and I think we'll have some folks pop on.
Yes, we have a few questions. So the first couple, I'm actually going to ask our public health team if they would be willing to chime in. Jenna Hapgood-White and Chloe Green. So the first is, how much would they say that the decrease in cases has to do with the increase in testing to catch cases earlier versus perhaps change in behavior, or maybe a combination?
Yeah, thanks, Casey. So we would say it's been a combination of both, really, right? So testing more frequently and doing the individual testing really gives us an insight and catches virus much earlier in someone's viral progression. And then the change in the behavior that we've seen in the last 2 weeks has also really helped. So we wouldn't say one or the other was better, but both together really helped to see that decrease in cases and see this decline that we're on currently.
Yeah, I really agree with that, Jen. I think, the being able to respond really rapidly, which is what the individual PCR tests and the testing twice a week allows us to do, is super important. But, the cases would still be there if the behavior was still going on. And the fact that the cases have come down so much, it also really does clearly, people got smarter about what they were doing off campus, and they looked at the data and they made the right decisions for themselves. And so it really is a huge, we're in this together moment, as I think I said in my note 2 weeks ago. Yeah, both were really important. And special thanks to the health team who helped us, and also the testing team who helped us make that switch to the individual PCR. They all worked all Labor Day weekend to make sure that we brought this under control. And so just everybody did their part.
Great, thank you. And a follow-up question is, will twice per week testing continue through A and B term for undergraduates?
Yes. So
Yeah, the question's about the break, though. We actually haven't talked about the break, right? So that's actually a really good question that we should answer and get back to them with. Yeah.
Perfect, thank you.
Yeah, but yeah, we'll definitely for A and B term, we're gonna do twice a week testing for undergrads through A and B term. The break, though, is a specific point in time when we actually have to think about it a little bit more, and we'll get back to you. Yeah.
Absolutely.
It's a really good question, actually. I'm glad you asked it because we hadn't talked about it specifically yet. So we will.
I've jotted it down in my notes, Lori. We can definitely figure that out.
Yeah.
And I'm wondering maybe if Emily or if Philip can share a little bit about some more detail on where we've added more outdoor seating options in and around campus. Both, I think, the lovely red Adirondack chairs, and I know there's some other tables and chairs that have been added.
sure, I'm happy to do that. So we have seating outside the back patio of the campus center. You'll see seating there. You'll also see added seating on the quad. Once homecoming is over this weekend, that tent that you see there on the quad will be full of tables and chairs for you to be able to dine outdoors. We've also added additional seating and Adirondack chairs just across the campus. We are also adding some on the walkway between East and Founders as well. You'll see some new seating there as well. So if you want to dine outside or you want to hang out outside, you want to study outside, odds are there's a seat for you.
Thank you. And President Leshin, maybe you want to speak to this a little bit. So this is a little bit of an involved question, but it's really speaking to, what would your message be to those students from their perspective? Think, I'm vaccinated. The worst thing that could happen is I might get a mild cold if I happen to get COVID. And so maybe I'm considering not changing my behavior and not following the suggestions the institution is providing. Wondering if you might speak to that a little bit.
I get it. I actually had a really good conversation with a student at my student office hours this week. Just sort of saying, look, at some point, we have to stop treating this like a total pandemic, right? At some point, we're going to start living with this virus in our community, broadly defined community. And I agree with that. At some point, we will. But here's what I would say. While it might be true that any one student might only get mild symptoms and might not get that sick, two things I would say. One is we have immunocompromised students and students with health issues in our community, and they might not be so fortunate with the outcomes that they would have, and they're more likely to be infected. The more cases there are on campus, the more opportunity for infection to spread. They're more likely to get infected. Here's the other one, and again, we don't have any evidence that things are spreading in classrooms. That we have a lot of evidence that campus is safe, but we also have a lot of faculty members who have kids at home who are and staff members too, by the way, who are of an age where those kids don't have the option of being vaccinated yet, right? And so that's scary as a parent to think, wow, I'm at work and even though the chances are low, they're not zero, that I'm going to get infected at work, and I might have to bring that home to my kids who don't even have the option of being vaccinated yet. So I just think it's too soon to say, we just got to let this run, right? It's too soon for that. And for those couple of reasons, we would just ask people to think beyond themselves, not just, I know I'm not going to get very sick, because that might well be true, but we're in this together, and this is a community, and we're a community that is, in spite of the fact that we are still dealing with COVID more than we want, we also are much more back to a more normal operation than we were a year ago. I mean, campus feels very different than it felt last year. And that is us really working to do all we can to give folks more of a sense of normalcy. But there are probably still some limits that we need to pay attention to. Not forever. It won't be forever. I promise you that. But for now. And I wish I could tell you exactly how long that would be. I can't tell you that yet, but just a bit longer.
Thank you very much. And the next question, I know Christine and Sherry had the opportunity to answer it in the chat, but I think it would be good to also answer live. And just speak a little bit about some of the safety protocols we're putting in place for homecoming this weekend, as well as the family weekend that's in a few weeks. And I think certainly Philip Clay could also chime in on that as well.
Yeah, Philip, if you want to answer, I'm happy to just support on that one, or whatever you want.
Yeah, Christine, why don't you start? I know we also have Aubrey Valley on the call too, so I think Aubrey can talk specifically about homecoming. So Christine, why don't you start with family weekend, and Aubrey, maybe you can jump in and talk a little bit about homecoming.
Sure, happy to. And I think you'll probably find a lot of similarities between the precautions that Aubrey is taking for homecoming as well that we're taking for family weekend. We're following the guidance. The best thing that we can do is, have as many programs outdoors as we possibly can. And that is our plan. I would say 99%. I think all but one program is outside, rain or shine. And so taking advantage of outdoor opportunities, we're having a registration process, attestation forms. We're asking people to wear face coverings indoors as well as outdoors, even though our programs are outdoors. We're encouraging folks to eat food outside, to minimize immediate family members who are visiting campus, to help de-densify, because we know Family Weekend is a popular program. And then, of course, encouraging folks to practice social distancing and just following the expectations that we have of our students and of our community for our everyday events that are taking place on campus. And Aubrey, I don't know if there's anything additional that you're doing this weekend for homecoming.
You covered all of it. The same protocols and guidelines that are in place for family weekend will be in place tomorrow for homecoming. We have an on-site check-in form that we were asking everybody who would like to access the quad to please complete that when they come to the quad. That will help us with contact tracing should we need to do any of that later on. There is a health attestation in that form, and also consent to our normal homecoming protocols. There's going to be complimentary food out there, so students are more than welcome to join us. If there are student groups who are hoping to connect with some of their alumni, we are encouraging those student groups to please ask their alumni to join them on the quad, not to meet them in other places on campus or off campus. We really want to try to minimize the number of places that our alumni are roaming around during the weekend. So the quad is the best place to be.
What I might add to what Aubrey just said is that many of the events for homecoming, because honestly, the planning for homecoming was so close to this uptick in cases that we had to pivot pretty quickly and look at the events planned and said, okay, we're going to need to make some changes. Aubrey just talked about all the things that were going to be taking place outside, but things like the rope pull, because of you can't stay 6 feet apart when you're on a rope behind someone else. That's a program that has been delayed. Similarly, the Athletics Hall of Fame banquet, which is normally an indoor activity with a lot of people at a dinner. Again, that's something that for this year we had to cancel or postpone because of the timing of homecoming in relationship to the cases. And so the homecoming program, the formal program, is really a 3-hour period. And then I also see Donna Harmon on the call, and maybe Donna, you might want to talk about the athletic competitions and some of the adjustments that we've made to those for homecoming.
Happy to do that. Thanks, Philip. So for the different events, we have 3 contests. Obviously, the larger event will be the football event that our alumni and students will be able to attend. And we will have visitors from RPI coming, and we've asked everybody to mask outdoors, and we're pretty diligent about that, which We do hear from people when they're coming in, why do I have to wear a mask outdoors? Well, because it is a larger number of people, this is what we wanted and needed to do in order to make sure that we provide as safe an environment as we can. We also ask people to spread out amongst the grass areas and around the fencing so that there's proper social distancing. So that's the work we'll be doing during primarily the football game, but also the contest before and after that we have too.
Great, thank you all. And I have the privilege of serving with just about everybody on this call on CERT, which is a delight. And I just wanted to kick it back over to President Leshin for any closing comments to wrap us up.
Yeah, again, thanks to everyone for coming and for asking your questions, providing your input. Please do get involved and stay engaged with us as we continue to work our way through this, help others who may not have had time to attend, understand where we are and where we're headed. You know, you all communicating with your peers and colleagues is the best way we can spread information. And then the last thing I'll say is go WPI football, beat RPI tomorrow. Let's crush them. Bye, everybody.
All right, well, I think we're all set.
Okay. Bye, everybody.
Thanks, everyone. Have a great rest of the day.